Thank you very, very much for that introduction. And thank you so much, Total Health Conferencing, for having me on and allowing me to make this presentation today. So, as you got from my introduction, I've worked in the area of oncology for about 28 years. And one of the things that I've learned in working with patients, which I think translates to working now in this era of COVID-19, is that whole dealing with the uncertainty. And initially, when we started seeing cancer patients during COVID, one of the things that a lot of the patients initially were sharing with us is that they were used to dealing with that fear of the unknown and what was going to happen. And COVID had a lot of the same unknown. They also shared that fear of life and death. And I think at the beginning of COVID, we all had that fear, and we still do. So, as a healthcare provider, there's that additional stress of needing to be there for our patients, but ourselves now dealing with something that has that potential to hurt us, hurt our family, is hurting our family. And so I think that for healthcare providers, the COVID-19 situation has been particularly challenging and tough. Um, I think one of the really difficult parts of going through this whole pandemic is that as healthcare providers, we're supposed to sort of always appear that we're fine and not always feel that we're allowed to express how we really feel. But with COVID-19, the anxiety is there for all of us because it's not just that it's affecting patients that we care for, as we're typically accustomed to. We're now actually having to deal with it ourselves, our immediate family, our loved ones, and the entire world is dealing with it. So I think one of the initial points that is important for all of us is to acknowledge that anxiety is normal. It's expected. I think that if people tell you that they're going through COVID-19, particularly as a healthcare provider and a nurse, and that they're fine, I think that's really strange. I think it's normal. And it's the uncertainty. And I also think that the anxiety manifests itself in many different ways. And it's sort of a roller coaster of emotions that we feel. We might find times when we're feeling very scared. We may, at another point, feel anger. You know, how can this be taking so long? Now, with the vaccine, it's taking so long for the rollout to happen. And so, you may be scared one moment, angry another moment, sad. I think for healthcare providers to feel that we're not as connected to each other. There's also the loneliness that patients are expressing. And as healthcare providers, we're expected not only to take care of the medical, we always took care of more of the emotional as well. But now all of a sudden, many times it's the nurses that are the sole person that patients have there for them. There's that guilt of, could I be doing more? And the grieving, there's definitely grieving. It's the loss of not only of patients and people we know that are going through COVID-19, but the loss of the life we had. All the events, major life events that are being missed, that we're losing. And then we might have times when we feel calm and other times when we feel grateful. So I think to have this whole roller coaster of emotions does produce anxiety. And again, it's all normal, but that doesn't mean that it feels good. Even if something is normal, it doesn't always feel good. And anxiety is really worry, nervousness, or a sense of unease about something that is uncertain and that is perceived as a threat to survival. That's what anxiety is all about. And it actually is adaptive. We've developed anxiety as humans as a way to prepare ourselves for a threat to our survival, right? It's that whole fight or flight. So that if we perceive something to be a threat to us, our body prepares to deal with that threat by either fighting that threat or fleeing from that threat. And how does the body do that? Well, we get our muscles tense up, we change our breathing so that we can bring in more oxygen. Our heart, starts pumping faster. It actually goes to the major muscles in your body, like your thighs, your upper body, to really move. So when people get anxious, you're going to have muscle tension, you're going to have racing heart, you're going to have a change in heart rate. At those times, you might be more vigilant. So you're feeling on edge. It's difficult to concentrate because, again, you are searching for whatever it is that you feel is threatening to you. When the threat, as COVID-19, is not something that we can see, and as healthcare providers, it's not something we can always run from or fight with, because as frontline workers, for many people, you have to be there. So your body is preparing to deal with this threat and preparing and heart racing. And you know what? You're there, you're stuck. So that adrenaline is going, but you're not able to really get out of the situation. And so that's when many times you notice that, the difficulty breathing, you feel restless, you may feel clammy. Again, all adaptive. If you really are running from a threat or fighting a threat, you want the muscles in your body to be prepared to deal with it. But when we're stationary, then that adrenaline going just leaves us feeling very much on edge. Often people will say that their mouth is dry, that they may have diarrhea, they may have a lot of urination. And again, that is all normal, because if there is a threat to your survival, your body does not want to focus on digesting food. And that whole saying, scared shitless, is because if you need to fight or flee, you don't want to worry about that digestion. So again, all very adaptive, but very uncomfortable when we're not able to fight or flee. Again, the dry mouth goes along with that. Feeling lightheaded, you don't need to do any abstract thinking when you need to fight or flee. And again, the feeling clammy or sweating, you're more slick, your body's slick. So if somebody goes to grab you and you're cooling off. So again, all very adaptive when you have that type of threat, but not for COVID-19 or any threat or any anxiety we feel that we can't physically flee from or fight. So what causes your anxiety or stress? So this talk is directed at COVID-19 because this is unprecedented stress that we're going through, because this is an unprecedented situation that nobody could have prepared for. If anybody would have asked us in February of 2020, nobody could have predicted that a year later we would be in this situation. But, things that are normally stressful, of course, are the death of a loved one, when you're worried about your family members, health concerns, work problems, financial problems, divorce, those all make sense. But it's important to keep in mind that we do get stressed and anxious, even for positive things: new job, new home, a wedding, a new child, grandchild. So stress is part of life. It is much more stressful right now. But I'm hoping this talk applies to even once we get through this pandemic. You can learn to use some of these skills. If you've been using them already, just continue to do that. But even positive things bring about stress and anxiety. Now, some people cope by smoking or overeating. We know that alcohol consumption has gone up greatly during COVID. There may be more recreational drug use. People get paralyzed with the anxiety and are not able to move or take care of themselves. They become more irritable. Of course, if that stress and that anxiety becomes very severe, then it can become debilitating. And those are the times you would need to go speak to a mental health provider. Again, I think that during this time, there may be a little more alcohol use. A little bit is fine, it's normal. Not exercising as much, normal. A little bit more irritability. Again, these are not the best coping strategies when they are used in excess. Of course, any smoking is not good. Drug use, again, not the best coping strategy. So again, these are ways that people do cope, but that are not always the healthiest. Important to think about when you're dealing with a stressor, when something scares you and causes anxiety. Is it something you have control over, or is it something that's uncontrollable? And there's different ways to cope depending on the type of stress. COVID-19 has aspects of it that are controllable, but for the most part, it's uncontrollable. We do not have control of most of what's happening with COVID-19. When a situation is controllable, we tend to use strategies to cope with it that involve problem solving, and we're able to think through ways to cope. With an uncontrollable stressor, as a lot of COVID-19 related facets of the anxiety come out, there isn't anything you can do. You can't sit there and logically work it through. So you then find emotion focused strategies to cope. You find ways to cope with the anxiety that help you cope with the uncomfortable emotions, and find ways to deal with those emotions because you can't logically just work it through. So, how do you cope with anxiety or stress? So we talked about some of the ways that people cope in terms of maybe overeating behaviorally, overeating, not exercising, but we also do things mentally in how we cope that can be helpful and sometimes not as helpful. So for example, sometimes one of the things we do if we encounter a stressful situation is we worry excessively. It is important to note that worry is completely normal. It only becomes problematic if it's excessive, or when it's this hypothetical type of worrying, the what ifs. What if this? What if that? And so if the worries are what if and they're controllable, then you can again form your list of problem solving ways and it makes sense. But when the what ifs are things that you can't problem solve, then it is not helpful and it increases anxiety. So examples, I know I'm following all the guidelines, but what if I spread the virus? Okay, that's not helpful, that what if. What if someone gets too close to me at the supermarket and I catch it? Again, there's certain parts that are not controllable. So we'll talk about what to do there. Other ways of thinking that make people more anxious, and we all do some of this. So again, it's not about doing some of it, it's when it becomes excessive. Threat scanning, when your mind searches the environment for what you fear. Threat scanning is often associated with your mind assigning meaning to harmless events. So for example, you're frequently checking your body for coronavirus symptoms. So constantly scanning your body, obsessively checking the news for coronavirus updates. What's the latest? Is the vaccine available? And it becomes too much. Again, some is okay. It's when it becomes excessive. Catastrophizing. This is one I tend to do a lot. When your mind jumps to the worst case scenarios, this idea of making a mountain out of a molehill. And when this happens, you feel that tightness in your chest. Your mind tells you that you have the coronavirus and your life is in danger. You may be feeling that tightness in your chest for many reasons. One of them may be anxiety, but immediately you say, oh my God, my breathing is different. It's the coronavirus. Your mind gives you the mental image of losing all the people that you love in your life. Again, you're jumping to the worst case scenario. So what can you do with this type of thinking? And again, I'm saying this thinking is common. We all do it at times, is when it is excessive. So notice when you have these thoughts. So if you do the what ifs, notice the thoughts, write them down. And then if there's some that you can control, okay, some events that are controllable, write down within those thoughts what you can control. What's important in your life and you can have some control over, and try to focus on that. What is controllable? Setting up a routine, wearing a mask when you go out. If you really get anxious, then, maybe wear a shield as well. What do you have control over? wear gloves. But you don't have control of whether the schools were open or not, when the vaccine is going to be available in your area for maybe a friend that you love dearly who doesn't meet the criteria right now. So we'll then focus on ways emotionally to deal with that anxiety. But in terms of problem solving, what can you control and how can you do it? If you're catastrophizing, what is the worst possible thing? I do think, again, limiting your media contact is important and redirecting your attention to the facts. So don't go with the what if, what if, what if. Get back down to the facts, redirect. And I love these couple of quotes. Freedom and happiness are won by disregarding things that lie beyond our control. If not what happens to you, but how you react to it that matters. When something happens, the only thing in your power is your attitude toward it. You can either accept it or resent it. And I think these quotes really are important, not only during COVID, but throughout our life. And we know this as healthcare providers, but we're human and we forget. And so sometimes just even reading those quotes and reminding ourselves of that can be helpful. So, general strategies to help cope. Thought challenging when catastrophizing or hypothetical thinking. So, again, if you're noticing the what ifs, stop, challenge those thoughts. Does it make sense? Are you just sort of, again, going on and on about it? Limit the thoughts, write them down. Very important, and I follow this. Limit the time you watch or listen to news on the coronavirus. I think this has been going on for a year. I think that we can get overwhelmed with the news. And I think it's important that we sort of maybe listen to it once a day or, twice a day, but again, limit. And again, keep in mind that the people that are doing the news, they need to make things very sensational to keep you watching. So they're going to do things in a very exaggerated manner, and they're going to make the news feel like this is impending doom because that's what they need to do to keep you hooked in, to keep their ratings. So keep that in mind. If you're working from home or at work, you do need to schedule regular breaks. This is easier said than done, but I think it's critical. Drink some tea, connect to others. If you're physically at work, walk outside if you're able to, or go to the break room and just talk to others. We are social. As humans, we're social. We need others. And so with all of the restrictions that have been taking place, we haven't been able to be there as much as we'd like to. And so do that with your coworkers. I think that in the past, we are a very future focused society where we think in the past about our past and we think about the future, and we're not always present day to day. So I think it's important to write down daily goals that we have for ourselves, maybe weekly goals, but don't go too far into the future because it's so uncertain. I remember when this whole coronavirus situation started back in March of last year, the thought was by the summer it'll be better, and then it'll be better by the fall, and then by the beginning of 2021. And that date keeps getting pushed. So if we think too much into the future, we set up ourselves for disappointment. And it's interesting because as a person, I tend to think about the future a lot. That's just my personality, even though I know it's not always helpful. And my daughter was very funny. She told me, actually last summer, I think you need to really rethink things because your old strategy of planning ahead is not working. You need to just really keep it to the day and maybe the week. And she's right. This is a good time to try an app like Calm or Headspace that may help you with meditation. Research has shown over and over again the benefits of meditation. Again, you might want to set up time to do this. I like Headspace because you can start off by meditating 1 minute, then 5 minutes, then 10 minutes, and it doesn't come easy. So again, it's being patient with yourself. I think it's important if you're working from home, to sort of keep your workspace tidy just so that it's limited and you don't have workspace sort of invading a lot of your home. I think important to create if you're working from home a day, a ritual for the end of the day, because it's so easy to find that the boundary between work and home life is not there. Your work life is invading your home life. And we need those boundaries. And so that may mean creating some ritual to end the day, or if you're going to work, when you drive home or you get on a train or whatever you do, find a way to end it, whether it's listening to a podcast or a book on, an audio book or music in the car, something to finish the day and to sort of contain it. I think important during this time to create some family traditions. I think that this time will be talked about for decades to come. And it would be neat that we can say, during the pandemic, every Saturday, we had this family tradition. And it could be a Zoom tradition of playing games with your family that may not be with you. Or, we have in our family, we do Friday nights, we order in dinner, and we're doing different, countries that we're ordering from different countries or different ethnic foods. Important to keep a regular sleep schedule. And then, I put this, be kind to yourself, because I think that's critical. I think there's a lot of grief during this time. And I think it's important to acknowledge the grief, the loss, the pain during this time, and that it's really sad. There's this tyranny that we need to be positive. For many of us, it may be if we're in healthcare, we have a job, so we shouldn't complain, right? So this stopping the comparative losses and feeling shameful, well, we have a job, so we shouldn't complain because so many people don't have a job. And that's true, but that doesn't make it any easier for ourselves, because it's still hard. We still are experiencing losses, and we shouldn't shame ourselves and force ourselves to sort of not allow ourselves to feel that grief, that pain, the loss for the life we had, the losses that we're going through, and not force ourselves to just be positive all the time. You need to be grateful, yes, but it's also important to acknowledge that our feelings and the sadness. And if we've lost people we love, we've lost patients, it's important to acknowledge those and realize that those losses may bring up emotions about losses we had in the past, deaths we had in the past that we may not have necessarily attended to as much, and we've been able to sort of put away. And realizing that grief is a process, it's unique for each of us. And, grief can manifest itself as anxiety. It is stressful. And it's important not to just suffer in silence, but seek support from others, and allow yourself to take care of yourself physically, emotionally. But most importantly, is to really acknowledge it, not ignore it, not shame yourself into feeling like, oh, I shouldn't feel this, I'm healthy right now, or, allow yourself to feel it and give yourself permission to feel it. You don't have to dwell on it excessively, because again, anything excessive can be difficult, but allow yourself to feel it. And don't feel you have to be positive all the time. And so when we talk about what you can do emotionally to cope with that anxiety, if you can problem solve it, make a list, problem solve, great. But sometimes, how do you cope with that emotion? And I think, again, I'm going to go through some of the things that we deal with our cancer patients and have done for years. But a big part of it is connecting to others, whether it be via a book club, whether it be by cooking together and sharing a meal. And this can be done virtually, but that sense of community is so important. And so reading, even if not in a book club, but reading on your own can be a great source of comfort for many people. And so laughter, whether you do that by watching funny movies, again, reading jokes, reading funny material, or just sharing via Zoom or in person and having that opportunity to laugh with each other. It can be so therapeutic. And we know that because the research shows this repeatedly. I put this up because I do think that pets, we bring pets to visit our cancer patients. And we know that for elderly patients, pets can be so helpful. And so, again, we've had record numbers of pet adoptions during the pandemic. So, I think that if you have a pet, or if you can get a pet, or if you can maybe visit a friend that has gotten the vaccine and you haven't, with safe distancing, pets we know can just really be very healing emotionally. We know that just petting the dog or the cat or the animal, whatever it may be for you, can just lower your heart rate and people feel calmer. Music. We all know this, right? You can listen to an inspiring song and feel inspired. You can listen to a sad song and just it can bring back memories that were sad. Music really can just bring about so many different emotions in us. And so during this time, whether it's listening to it on your own, or there are so many free concerts that are being offered by different organizations, I think can really be so helpful. I know that if I exercise with music, I exercise better. And again, tune into that part of yourself. Make time to do this. We've had patients who've been learning new instruments via Zoom. So again, it's a great time to try to be creative and find new things that you can do that help you emotionally to cope. Painting, and taking up some new arts. We can do this by, again, setting up on Zoom. There's so many YouTube videos. Museums have great programs where you can take museum tours. So if you're not into actually the art making part, I've been taking museum tours of museums all over the world because I enjoy art, but for whatever reason, I don't feel that I'm that creative. So I shouldn't say that, but my daughter has been doing a lot of art and using YouTube videos. Learning to knit or crochet, again, great time to do these things. Again, using videos, or again, connecting with knitting groups and making it more social. Journaling. We know, and research has shown over and over again, that journaling is one of the best things you can do to get your feelings out. And you journal without editing, you just get it out. And that seems to be really helpful for people. So get a journal. I think that in decades to come, it would be really fascinating to read back what we wrote during this time and to be able to share it with our children or grandchildren. It's sort of this document that we'll have to sort of use to share with future generations. And of course, spirituality. And that takes so many forms, whether it's prayer and being able to attend services virtually or in person, with the social distancing. Or for you, it may not be religious prayer, but it may be, really being out there in nature and connecting spiritually to nature, whatever it is for you, but connecting to that spiritual part of yourself. So many of my patients that have been in the hospital have found that the chaplain visiting them has been very peaceful for them and has brought them great comfort. And then, of course, finding new things you can do, whether it's, we're doing game night in our house and we've been doing puzzles, we've been doing Monopoly. And again, that's part of the family tradition, or maybe having it be video games that you play, and you can do this virtually with other people. So again, all ways to connect, words with friends, but finding a way to, again, engage our mind, our emotion, to help deal with these very trying times. Exercise, we know over and over again, and research shows this, it's helpful for prevention of everything, whether it's heart disease, Alzheimer's, cardiovascular, and cancer. So So helpful. And again, you can do that just by walking, and that's a nice way. You get out in nature or walking on the treadmill. You can sign up for Zoom classes. This is a great time. I personally love yoga. It's hard to do yoga and not and keep focused on yoga and worry. So a lot of exercise. I can do weights and still think about things I need to do, but I can't do yoga and keep my balance. So I find yoga really helps for me personally, physically, but it also helps the emotional part, my breathing, the emotional, spiritual, and helps me to keep focused in the present. So I quickly want to go over what we just discussed here. So really the importance of maintaining relationships and then using all of these strategies we just talked about, whether it be music or finding humorous things, exercising, spirituality, and then religion, whether for some people that's the way that they express their spirituality. Finding things that you enjoy, watching movies, reading. My daughter takes a lot of tub baths, very relaxing, and she buys those bath bombs and finds that. Whether it's massaging your partner or your family member, gardening. A lot of people have taken up gardening. And again, it gets you out, you're doing something out there in nature, you're planting, cooking together, producing something, drawing, painting, journaling, all the things that I just mentioned. And my goal here was to give you thoughts of things that you can pursue and use to help you deal with that anxiety and those uncomfortable emotions. And we may not be able to get rid of them because sometimes they're normal. And if they're not excessive, and you don't need to really seek any support from a mental health provider, it's a way of finding ways to channel it. Think about what you've tried in the past and what has worked, what hasn't. As I said to you, yoga seems to work for me, but may not be good for everybody. There's a great workbook that the Wellness Society has put out, the Coronavirus Anxiety Workbook. Seek support from others. And this I've done for years. My journal is a gratitude journal. So I write in my journal every morning and every night what I'm grateful for. And I've been doing this for years. I learned it from my patients. And it's really enjoy the little things. For one day, you may look back and realize they were the big things. And we realize that now, that going to the gym was something we really valued. It was a little thing, but we now realize it's a big thing. And there's a loss there. And we shouldn't minimize it because we socialized at the gym and we were motivated by others at the gym. So many of the little things we took for granted, we realized how important they were. So trying to do that and keeping a gratitude practice. And then obviously seek mental health support when needed. And I think personally, obviously, I'm a clinical psychologist by training. I've been in therapy on and off for years. I think so many times it's helpful just to have somebody to talk to that is there just for us. So thank you very much for your time. And I'll be able to answer any questions if we have any time left. Thank you again.